Today, we're also shining the spotlight on a rapidly growing medical condition. July is National Dry Eye Awareness Month. Dr. Gregg, the medical director for Eye Care Center in Raleigh, is here to discuss ways to prevent and treat dry eyes. Dr. Gregg, we appreciate your time with us this morning. Nearly 20 million Americans have been diagnosed with dry eye disease, and many more are suffering without even knowing that they've been diagnosed with it. First, let's talk about some of the symptoms besides that scratchy feeling in your eyes. It really causes a lot of issues.
Yes, certainly the scratchy, itchy feeling, but interesting, one of the main symptoms is watery eyes, and that comes from the inflammation from dry eye, and we get the reflex tearing, which are tears that are not helpful for the condition. Interesting also, we have blurry vision from it, where we're finding ourselves blinking a number of times is clear, blinking is blurry, and that can be very frustrating.
Yeah, interesting. If your eyes tear up a lot, that could be a symptom of dry eyes. So what causes dry eyes, doctor?
Well, as far as prevalence go, one of the main things right now is just simply not blinking enough. We work a lot on our computers, our phones, streaming video, and we're staring. Every time we blink, we're pumping tears out into the eye. A particular type of tear that's an oily secretion that helps keeps the tears from evaporating as much. Women are 2 times as likely as men to have dry eye. Contact lens wearers are bothered by it more. Certainly underlying medical conditions, autoimmune allergies, that type of thing. And certain medications can also cause or exacerbate dry eye.
And Dr. Gregg, there are treatment options there for people suffering with dry eyes to alleviate those symptoms. Share with us some of the options people have.
Well, we've certainly advanced dry eye treatment. One of the main causes is not actually not being able to produce enough tears. It's called meibomian gland dysfunction, and actually 85% of people have that. And that's where simply the glands in the upper and lower lid do not secrete enough of that oily substance that I mentioned before. And so that's what we actually treat. One of the most interesting things that's a new product out there, is somewhat of a game changer. It's called Evertears by a company called Thermodex. We've known for a long time that the main best way to treat it is with warm, moist heat and then lid hygiene. The problem is getting people to consistently and sustainably use warm compresses in the shower, that type of thing. But this is a new product. Comes in a little packet like this. You simply just open it up and you bend it, and it automatically heats up to the right temperature, 104 degrees. We hold it on one eye for about 2 minutes, flip it over to the other eye for about 2 minutes. Then it has these wonderful cleaning agents and hyaluronic acid as well, which is good for wrinkles, to clean up the lids. This is something we can do anywhere. I've diagnosed this condition for decades. I've treated it. This is somewhat of a game changer, and I use it.
Dr. Gregg, we have only just a little time left. Really quickly, what can happen if dry eye is left untreated? Can it lead to blindness?
Well, in certain countries it may, typically not in this country, but if we don't treat it, meibomian gland dysfunction is a long-term disease where the actual meibomian glands can actually atrophy over time. And once they atrophy, you don't get that back. So it needs to be treated on an ongoing basis. So any way we can do it in a sustainable fashion is the key.
Dr. Gregg, thank you so much for talking with us about dry eye disease and what people can do about it. Thank you so much.
Yes, ma'am.